Hello, I'm Jo Fay, and this is a SwissInfo podcast. SwissInfo is the multilingual and international public media company of Switzerland. This season, it's all about Silicon Valley here on the Swiss Connection Science podcast. We're asking what Switzerland can learn from the Californian tech business hub. Today, we're looking at healthcare and meeting an oncologist who talks about her own personal experience with cancer. So in this episode, Marc-André met and spoke to Pamela Munster. She's an oncologist at the University Hospital in San Francisco, California. Marc-André, at first glance, that doesn't sound like that fits within this tech series that we're doing. Why did you meet Pamela? What was her role in all of this?
I thought it was interesting to have somebody who is in the health business, because this is also a potential future. It has a lot of potential.
I guess is her job kind of at the intersection of the healthcare industry and technology?
Yes, she's doing both. The consultation.
Consultancy.
With patients, huh?
She's consulting with patients.
With patients, but she also makes research. And she has launched a company with a preventive treatment for cancer de la prostate. I don't know how to say it.
With prostate cancer.
Yes, prostate cancer. And but she herself was a victim of the breast cancer because she's wearing a gene mutation that makes your chances of getting a cancer
much
explode.
Higher. Yeah,
yes.
Right, okay.
And so she had a double mastectomy with reconstructive surgery after, and now it's about 10 years ago, and she's fine.
That's great.
She's
so she's
still
had a really...
skiing.
Still skiing, wow.
Yes,
so she's had a really close... she has a great personal story, I guess, which serves as a big motivation, not just her work, but of course her personal story, her family history, all kind of comes into this research that she's doing.
To summarize in one quote, she said, I don't speak about my case with my patients, of course, because they come here not to hear about me. But when a woman would say, you don't know how much I'm suffering, then she can answer, yes, I know.
Right. That must be really reassuring for the patients that she has personal experience of what they're going through.
Exactly.
So Pamela Munster actually had her ovaries removed preventatively because she knew she had this genetic inclination for a really severe form of cancer.
Yes, and the risk was high, so she didn't want to take it.
So we're going to hear the conversation that you had with Pamela Munster now. Don't be surprised, this conversation actually took place on the phone, although you did meet her in California.
Yeah, yes. I met her, but the microphone failed. And, that gives me the opportunity to say another thing about this Californian spirit and efficiency. Pamela waited for me at 9 a.m. sharp. I was there. She said, we have 90 minutes. So she took me to her office, which is 4 blocks away. 4 blocks, and she was walking so fast. But then I was out of breath. And we made the interview, then we made some shots in our laboratory, then made some shots in front of the hospital. And she looked at her watch and said, you are very efficient.
The highest
and
compliment.
She went. And then I noticed I had no sound on my recording, so I wasn't so efficient after all.
Hello? Hello? Okay, so when I came here, you told me something. You say, I didn't choose California, California chose me. And would you be kind enough to remind me how you landed in San Francisco from Switzerland?
So, Marc-André, the university called me and asked me to come to California and work in California. That's what happens to professors. They get called to a certain university. And quite frankly, I think I've always followed opportunities in my profession rather than specific geographic locations.
How long have you been here?
15 years.
I've seen you giving conferences on breast cancer throughout the world, especially in India and the Arab Emirates. Now, the health insurance system is very different in Switzerland as it is here in the U.S. What does it mean for you as a doctor? I mean, having patients who maybe cannot afford treatments, or would you dare a comparison between Swiss and U.S. system of health insurance?
So I like the concept of Switzerland of having mandatory health insurance for everyone, and I think the Affordable Care Act is doing this as well now. But, I think the problem is not as much as the healthcare system, but the problem is the level of poverty that the U.S. has, that I don't think Switzerland has. I think it's very different, the number of poor people with the access problems. So the healthcare system in the United States has three problems. One is financial access, meaning the inability to pay for. One is geographic access, meaning not being able to have access in a reasonable distance to a bigger healthcare system. And then the third one is social access, and there is still much distrust of certain minorities to the healthcare system. So there's not as much awareness of what can be done, what should be done with regards to health. Okay,
but you you are doing let's say upper level medicine. I mean, can poor people afford your treatments?
Poor people who get to me can, yes. So I think I have to say, having seen multiple healthcare systems over the world, for someone is well insured and is financially well off, the healthcare system in the U.S. is unparalleled. There's no two ways around that. And it's not as much as, I have patients who have no money and have no insurance, but they make it to me because the universities take uninsured patients who are poor. And that's really what I mean. But the geographic and social access is also a challenge, because someone actually has to be able to get to San Francisco and deal with the access to a major city.
Yes, I see. It's another scale, a geographical scale.
And then the other thing, think about it, right? Is like, let's say we prescribe a very challenging, complicated clinical trial that requires visiting every week. That is very difficult if you live 4 hours away.
You said somewhere that you and your teams are fighting cancer with creative approaches, and we in Switzerland are always very proud to say that we are an innovative country. What difference would you make between the approach to innovation between Switzerland and the place where you are now, California?
My personal experience has been that Switzerland is very innovative, but the encouragement is much less. So in other words, it's still the Swiss mentality to ask too many questions, whether this is going to work and whether you really can do this and why we need this. And these questions, I live in Silicon Valley, right? These questions are not asked in Silicon Valley. It's better to have a bad idea than no idea. And if it doesn't work, if an idea doesn't work, you don't get penalized. There's no price on failure in in Silicon Valley. You basically dust yourself up and you get up and try something else. I think that's very different, having gone through the Swiss system and having gone through the American system. I think if you can bring this spirit of innovation and experimentation to the broader population of Switzerland, then I think we could easily be at the level of Silicon Valley. Because the knowledge and the dedication and the workforce and the money is all there. It's that spirit that's still not quite there.
So let's come to your book. I took the time to read it, and it moved me a lot because it's supposed to be a book about your case, but in fact you mentioned so many of these patients you have been working with along. And
did you like my book?
I'm feeling like taking an appointment with my physician now to have some checks. Pardon?
I accomplished my goal. So I accomplished my goal.
Yes, I think that. Yes. So what I will keep from it is that cancer is something that I never imagined it was so complicated. There were so many different types of. There seem to be as many types of cancer that there are individuals. And this is one of the lessons I got from this book, and also the hope, of course, because it gives hope to read it anyway. But what was the idea? What was the spark that came to you? You say, I want to write a book.
Well, I did not want to write a book. I was talking to a friend of mine who said, you have a really good story, you should write a book. And I said, I really don't think I have the time or scope. And then he connected me with an agent, and the agent sent me a draft. So I figured, okay, it's not that hard to write a draft. So I wanted people to have a glimpse into what it means to have cancer.
Mm-hmm.
And I wanted to convey that there's always hope.
Yes, that's one of the things you understand when reading it. True, but there are quite a few personal details about the very intimate things. Was it difficult? You managed to write it with a sense of it's never. I missed the word in English really. Ce n'est jamais indécent. Il n'y a pas de voyeurisme, we say in French. I guess you understand some words.
Yeah. It was sort of personal, but it was not intrusive.
Mm-hmm. Yes, exactly. Yeah.
I think because I've taken care of patients for so long, I'm very, very comfortable with that personal vulnerabilities and intimacy, without making it negative.
Mm-hmm. You write somewhere, over the years I have learned to forgive myself for not being able to save everybody. But does it mean that you started to study medicine with the hope of saving everybody?
I think when you go into medicine, you do hope that you can heal people and save people from bad illnesses, and you realize that you cannot. But as a physician, you have a choice, right? I could have chosen a field where people don't die.
But then you could have chosen, because it's very challenging to choose oncology. You should have chosen pediatrics or another specialty. But oncology is very challenging. How did you come to choose that specialty?
I feel the oncology had a lot of room for research, and that was my main driver. And then, if I can make the last few weeks or months for a person different and alleviate suffering, then that's a big goal accomplished. And I think in part of through research, we have made such a big difference in people's lives. And my father had pancreatic cancer. He lived 6 years. Really, most people with pancreatic cancer don't, because he had the benefits of research.
Okay, so I have a very last question. The book opens and closes on the snow with almost dangerous situations you had experienced while skiing. I think I understood through the pages that you are doing a lot of sport, and you also mentioned your son who chose a healthy life. I had the feeling coming here in San Francisco that people are leading a rather healthy life. I saw many people running. I saw food was very healthy as well. Is it true? And does it have any incidence on the figures of cancer cases?
Yeah, I think that is very well established. Exercise and diet and a healthy lifestyle has a huge impact on cancer outcomes, particularly diet and exercise.
But is it the case in California? Is there, for instance, less cancer cases than in other places in the country or in the world?
I think this is getting to be there. I think colon cancer, lung cancer, colon cancer, and other cancers that are associated with smoking and obesities and lack of exercise, they are getting less. Yes, I think we start seeing these numbers.
Okay. I really thank you for this second chance.
No problem, anytime.
So thank you so much, Marc-André, for all of your reporting that you did in San Francisco, which has gone into these last few episodes of our podcast. I'm really sad to say that this was your very last report with us, and you've been working with us at SwissInfo for a long time. How long exactly have you been?
24 years.
24 years. And you've written so many fascinating science stories for our audience in this time. As far as I know, space research and planets was one of your particular areas of expertise. I just wondered, is your retirement going to give you more time to kind of delve into this area and keep reading about it, watching documentaries maybe, or are you going to be branching out into another universe entirely?
You want a real answer?
Yes.
Well, I'll focus on two issues: playing guitar,
nice,
and editing video. Because I have gathered, hours, days, maybe weeks of shootings, personal, private things, or also travels, and I want to make maybe open a YouTube channel.
That would be amazing.
I've been advised by my family and friends to.
That would be great.
Man, do a YouTube channel, but then if it happens, we must not expect more than one video every 2 months, let's say.
Okay, well, you let us know, and then I will subscribe and follow. Marc-André, thank you so much. You can find more on Pamela Munster, her company, and her book on our website. Just go to swissinfo.ch and search for Pamela Munster. And we're not leaving Silicon Valley quite yet. We have our science journalist, Sarah Ibrahim, join us for the next 2 episodes. She'll talk about her experiences and the people she met in the Californian tech world. That's coming up in our next episode, here on the Swiss Connection Science Podcast. Today's episode was recorded and edited by our science and video journalist Michele Andina. For more content, visit our website, swissinfo.ch. I'm Jo Fay. Thanks for listening. Get ready to explore the crossroads of innovation and entrepreneurship. Listen to our latest series of the Swiss Connection podcast, where we dive into the fascinating parallels between Switzerland and Silicon Valley. Switzerland and Silicon Valley are hubs of cutting-edge research and groundbreaking innovation. But what makes Silicon Valley the pinnacle of entrepreneurial culture and investment? Join our journalists Marc-André Miseré and Sarah Ibrahim as they venture into the heart of Silicon Valley. They sit down with Swiss-born entrepreneurs to uncover what Switzerland can learn from the world's tech capital. Get inspired by real stories from leading innovators in technology. Listen and subscribe to the Swiss Connections latest series now. Available wherever you get your podcasts.